Hi everybody, Scott Berns, Senior Vice President and Deputy Medical Director at the March of Dimes National Office here at the 2012 AMCHP Conference. It's great to see everybody, and there's a lot of great work going on out there. A lot of news over the last couple of weeks, which is going to hopefully give us a lot of momentum and catalyze our work going forward, particularly around preterm birth prevention. Just to reflect back on the past couple of years, we finally have seen the preterm birth rate in our country start to come down thanks to all of your work. We peaked at 12.8%, and it looks like after 4 years now we've had a steady decline, and 2010 preliminary data shows us just under 12%. So great work. Still a lot of work to do. It's still about 500,000 babies born every year in our country, born prematurely, born too soon. And there's just a great announcement last week that we heard about called Strong Start, which Secretary Sebelius announced, and it includes some grant funding, around $43 million, to help states and others out there reduce preterm birth through enhanced prenatal care models. So go get that money and partner and have an impact. Also, we're going to be partnering with HHS and all of you out there on our public education campaign to eliminate non-medically indicated deliveries before 39 weeks. We're going to have public education messages out there around allowing labor to begin on its own, and it's going to be great, and I'm looking forward to actually premiering a PSA here at the AMCHP conference. And you know, we really have to work on those elective deliveries before 39 weeks, those elective inductions and C-sections, because babies born just a few weeks too early can go on to have lifelong health problems. Those babies just a few weeks early, born just a few weeks early, have more problems with their lungs, their brains aren't fully developed, and as you know, babies born prematurely, under 37 weeks, they can have lifelong health problems. So there's a lot of work still to do. We made a lot of progress already over the last 4 years in reducing preterm birth, and the March of Dimes is looking forward to continuing to partner with you. And I also wanted to thank AMCHP and all of you, all the members of AMCHP out there, because I know that I know how hard you all work, and I appreciate that. Oh, and another thing, very exciting. I'm happy to be co-chairing a subcommittee with Mike Fraser, the CEO of AMCHP. We are working together on a Healthy Babies initiative. This is in partnership with ASTO, the Association of State and Territorial Health Officials. Dr. Lakey from Texas announced his presidential challenge just a few months ago, combating infant mortality, and specifically to reduce preterm birth 8%, to reduce preterm birth 8% in every state by 2014. And Mike Fraser and I are co-chairing a subcommittee of that effort, looking specifically at best practices and policies that we all can implement around the country to make a difference. So continue your great work, and we need to just continue to push forward to help moms and babies. And that big announcement last week by Dr. Sebelius that announcement by Dr. Sebelius really put preterm birth at the forefront of the nation's MCH agenda, and that is really great news for all of us, and combating the #1 obstetric problem in the country. Thanks, everyone.